if you are aiming to go into these communities, it has to be in the mindset of how can we put our resources together and work together on our common and shared goals. That's it. You have this common goal, you outline that common goal, and you say, this is what we can bring together and bring to the table to help those in need.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest doing some incredible work. Wanted to bring her on to really discuss, how she got where she is, and then also kind of go through the incredible work that they're doing. I wasn't aware of it, and it's really interesting. So, Tiara Green, please introduce yourself and please introduce your role and what you do.
Absolutely. Thank you for having me, Cole. My name is Tiara Green. I am the president of Accessia Health. Accessia Health is a national nonprofit organization that provides financial assistance, education, and resources to individuals with rare and chronic conditions. We've been around for quite some time, and we really want to bridge that gap for individuals who have a rare and chronic condition so that they can focus on their healthcare journey. So if you notice our logo, there's a little feather. We want to make that burden as light as a feather as they are healing and seeking the medical care that they need.
I thought that was the coolest thing when we had met for the first time a couple weeks ago. That was such a great idea with the feather. Um,
Yes,
You started as a program manager there
I did.
11, 12 years ago, right? Did you ever expect to be the president and CEO?
No, I did not. So started, you're right, it'll be 12 years in September. And started as a program manager. My background is public health, community health. So this was right in line with what I wanted to do in my career, being able to help individuals afford health care. Over time, I just worked my way up. Started as a program manager, moved into a director role for a few years, found myself as an executive, and then stepped into this role almost a year ago. And I'm a believer in everything happens for a reason. I am right where I need to be because the mission of Accessia Health is one that I believe deeply and want to make sure that we are helping individuals as they navigate the healthcare system.
And that's another reason why I wanted to bring you on too, is because you have that experience and that purpose that I share as well. I love that you're aligned in that area, but you have so much more experience than me. And I think that's really important because right now people are afraid of all the political changes. You've been through 3 or 4 different administrations, seeing how that's affected things at, Excessia. I mean, in your lifetime, of course, but I think that's really important as well as understanding the economic challenges, the technological challenges, and then also the political changes. I think that's the first question is, as a leader that has done so well, it has gone through the ranks during that time, during these changes. What's your vision for the future? What are you looking towards? How are things working out?
Well, it is always changing. I always say healthcare is the industry that if you blink 2 times, there's probably going to be a change that you missed, but it's ever evolving. So for us, we're constantly keeping our ear to the ground to say, what is coming up? What is going to impact those individuals that we serve? And I try to be very strategic about and intentional about saying individuals and not patients because they're people first, right? How can we help them in this changing landscape? So we're constantly watching the policies that are coming out, and then we're adapting internally to say, we understand that this may impact our population in this way. And I'll just take, for example, the Inflation Reduction Act. As of January 1st, 2025, Medicare beneficiaries with a Part D plan now have a cap that they have to pay out of pocket of $2,000, right? So we take that and we say, what does this mean for those that we serve? We know that $2,000 is still going to be a lot for these individuals to afford, and they're still going to need assistance paying for their out of pocket costs to see their physicians, to pay for any laboratory testing to pay for durable medical equipment. And we step in and we adapt our services to meet those needs. So we are proud to say that we have this holistic approach where we don't necessarily focus on just the copay of the medication. We understand that a lot goes into that. You need help paying for your health insurance premiums. Individuals need help paying for travel to see their physicians or to go get that infusion every week, every few days, whatever it may be. There's a cost behind it. So we step in and we adapt based on those policies when they are implemented.
It's so tough too because sometimes when you're working in insurance or when you have a employer that pays for your insurance, you think when you hear some of these changes, oh, that'll be tough. They'll have to tighten up a little bit. But that's not the reality. They're already beyond the ability to tighten up. I've been on SNAP and Medicaid myself, so I know, right? It's not as easy as some of us might think. And so another one of the questions is, how do you stay personally as an executive? How do you stay motivated to keep doing this work when it feels like it gets harder and harder year after year?
Honestly, I I understand the patient journey, right? So what
Mm,
keeps me motivated is I have to live this very life that our patients live, our individuals that we serve live. As a mother, as a patient myself, as a advocate for a mother and a grandmother and fathers and father, I put myself in the shoes of those that we help because I walk those shoes. I walk in that same journey, and know how difficult it's going to be. That's my motivation. It's not easy, and we want to make sure that, as much as we understand the journey or I understand the journey, that it becomes easier for somebody else.
What are you doing to make it easier? Because sometimes it feels like I said, just getting by is kind of where a lot of times where we're at when it comes to that. So how are
Yeah.
you trying to, what are you doing at Excessia to make things actually to lighten that load, like the logo kind of represents?
Yes. Education. I think about where my journey began in this public health world. I started off as a home visitor, right? And it was
Okay.
all about education, all about giving individuals, and these were new moms at the time, giving them information about caring for their newborn child and how to connect with them on a deeper level. There is something very powerful about education and health literacy. So when you think about health literacy, I always start with the definition of it, right? The ability to find, understand, and use health information and services to make informed decisions. It's more than just saying, "Hey, I think I know what insurance means." It goes beyond and says, "I think I can understand even what my physician is saying to me when I have a visit." So it's that education that we're providing. We are excited to have our education series, Amplify Your Voice, Control Your Care. And this is where we hope to equip individuals with education and resources so that they can make informed decisions. And this is twofold when you think about that. Number one, it's our personal health literacy as individuals, but as an organization, this is where we say we are enabling people to find, understand, and use health information and services. So when you tackle health education and literacy, it increases healthcare utilization, but it also um, helps them stick to and adhere to a medical plan for their condition and receive the proper screening and be able to properly communicate with their physicians. So that's one of the ways that we're trying to make that load lighter, and helping them understand their healthcare journey.
Why did you I mean, I know you mentioned that you had done gone in and visited individuals and educated them earlier on in your career, but what about that actually is made you want to kind of do or implement this at a more high level, right? Because there's so many different, that's
Yeah.
one of the issues. We're pulled in all these different directions, right? Because people
Mhm.
need help in
Mhm.
so many different ways, and it's hard to pick what way we're going to start to focus
Yeah.
on. So, why did education really stick out to you? How big of a problem is it?
It stuck out. So my undergraduate degree was community health education. I knew
Uh,
very early on what I wanted to do. It took a different shape. I initially wanted to be a physician, and didn't finish the pre med classes and went straight to community health education. For me, I knew it was my passion. But we know that the impact of education, when you ask the question of what is the impact, we know that it leads to higher hospitalization rates, higher emergency room visits, longer hospital stays. And we can't afford that as a nation. We can't afford to have individuals being reactive instead of proactive.
why is that? I guess one of the maybe questions, because you work with individuals in the community a lot. Why is what is happening, I guess, when we have individuals with diabetes, for example, that keep going to the ED, um, that aren't really in communication with their primary care physician? Why what lack of education have you seen in that area, for example, that's causing some of that to happen? Just for the audience who might not be aware of that.
I think this is where we get into health inequities, right? We look at the social determinants of health. We look at unequal resources and systemic issues that are throughout our country. We can't ignore the socioeconomic factors, and lower income individuals usually have a higher chronic disease rate. So we have to look at where are individuals living? What resources do they have access to? What is their education level? How are we going to get them into the jobs that they need so that they have the income that they need to take care of their health? This also goes back to a trust issue as well, with being able to talk to my physician and feel like I'm being heard. It's more than me just going to this visit and saying, hey, this hurts, right? It is the response that I'm receiving from that medical care provider, in that they're hearing me truly and are willing to help me feel better. So we actually have a program. It's a partner. We're a partner in the Louisville Community of Care Project. And this is one zip code in Louisville where we are saying if we just work with faith based leaders and community health workers in this area, we can bring people into the care that they need. So this project is led by the Coalition to Transform Advanced Care. Accessia Health is a partner in that project. And our role in that project is just to help people pay for screening, right?
Mhm.
8% of the nation receives the clinically recommended screenings at the appropriate time. Only 8%. So the other
Wow.
92%, you think about at what age are you supposed to receive a colonoscopy? How often are you going to your physician to check your blood pressure, to check your
Yeah.
cholesterol levels, your glucose levels? How many people are receiving mammograms, right? So we are stepping in that project to say, we know that that is a cost burden. We know that that is a barrier to care. And we are here to help pay for that for individuals who are uninsured or underinsured who have a commercial health plan. So, you and I may have insurance through our employer,
Right.
and it doesn't necessarily mean that this is going to be affordable to receive a colonoscopy,
Mhm.
right? To receive a mammogram. But we want to step in to say we will help pay for those items.
And that's a big deal, especially if any of those out there are aware of the ACA plans. I did, quite a bit of work on ACA plans throughout Philly, and most Philadelphians, right, if we're being honest,
Mhm.
can't really afford to use the services. If they're on the ACA plan and they qualify for it, even with discounts, it's not really something that they're going to be able to really
Right,
use.
right.
Sometimes we like maybe pedal around that truth a little bit and say, "Oh, it's a great thing," right? But it's like they really can't use it. And so, why faith based? That's something that you mentioned. Is that you're going into these faith based centers? We're doing things similar in Philly. Why was that an area that you decided to put some effort into?
CTEC had this model, and they actually brought it to the partners to say, this is the way that we want to go.
Mm,
And if you think about that trust issue, one of the things you learn early on in the public health world is you go where people are. And that's really what they did. They went in to say, we're meeting them in their community, and the trusted resource in their community is the faith based organizations. So you partner with this trusted resource so that you can provide the care that is needed.
that's really smart. How do you have any tips on approaching organizations like that? Because you've been doing that a while, right? You've been working in organizations a while. Sometimes it feels a little awkward, right? When we first want to do that. I was talking to someone from Johns Hopkins the other day about how the doctors are afraid to approach the business students are afraid to approach doctors. It's similar with that in public health, right? We have hospital systems, and then we have the community organizations, and there's not really a lot of intermingling. So how was your approach to partner?
Public private partnerships are number one when you're working in communities. What most community based organizations do not want is for someone to come in and say, I have all the answers. Just
Mm.
follow me and I'm going to fix it. Why? Because they've been there doing it for a number of years. They don't want someone else to come in and tell them what to do and take over. They want a partner. So if you are aiming to go into these communities, it has to be in the mindset of how can we put our resources together and work together on our common and shared goals. That's it. You have this common goal, you outline that common goal, and you say, this is what we can bring together and bring to the table to help those in need. But it has to be in the that mindset of a partner and let me take control.
And to get really granular, let's pretend for a minute that we are a kind of executive at maybe a private organization, maybe not even related to healthcare at all. What would be the first step for that executive? Would it be sending an email to set up a meeting? Is that how do you take that first leap?
Mhm. Research is going to be number one. Before I even reach out, I want to know what projects are they working on at that time. What have they worked on in the past? What were the metrics that came out of that? So what were those outcomes? And if you're looking at the projects they're doing right now, who's already at the table? Who has a seat at that table? And how, as an organization, are we going to align with what they're already doing? And then, yes, I am 100% comfortable sending an email blindly saying, listen, you all are doing great things. I would love to chat more. Now, my initial email isn't going to say immediately, hey, let's dive in and partner. It is let me learn, because you have to listen first to determine how you can partner with that organization moving forward.
That's how you can tell you've been doing this for a bit, because I've asked that question a lot. I've gotten a lot of good answers, but research, I have not gotten that answer yet. And it's important because you were just talking about showing respect for the work that they've done already.
Yes.
If you have no clue what they're doing and you show up to, a vegan food bank with, a bunch of prime rib or something, right? That we don't want that to happen.
No, you clearly are not aligned.
With what's going on. No, seriously, and that's and it's important too, because everyone has so many motivations for doing different kinds of work. We all know that
Mhm.
a lot of times it goes down to trying to save the dollars as well. But for a lot of the public, organizations out there, that is not really their number one focus. And so I like that respect and transparency being number one. That's so
Yes,
important.
very important. Very.
When it come we've talked a bit about kind of care gaps, some of these population
Mhm.
health preventive measures, but then there's the issue of people with chronic diseases, rare diseases. That's a really challenging thing to manage as well. As we have made progress on CKD, of course, in general, we've gotten better at managing that, but there's a litany of other diseases, especially those that are less common, that people suffer with tremendously, that do not their burden is very heavy, right?
Yeah.
So how is Excessia, how are you guys lifting that kind of burden?
So we think about those with rare conditions, right? We already know that healthcare is unaffordable just from the sheer fact that Americans collectively have $220 billion in medical debt, right? Nearly 3 million individuals owe over $10,000 each. $10,000 each. So when you think about those with a rare condition where medications are extremely high, they may be seeing physicians more often than you or I are seeing the physician. the out of pocket costs are unbearable.
Hmm.
So they may have to spend tens of thousands of dollars in a year just to keep up with their condition. So when we talk about lightening the burden for those individuals, that is really what we're doing to say, let us help pay for that care because we know that it is expensive for those with rare conditions. And those are just for the individuals who know that there's some type of medication to treat the condition. But there are many rare conditions that do not have a treatment on the market.
Hmm.
So those individuals are spending time just taking care of the symptoms, and the physicians are trying their best for them to live comfortably without a treatment. So we ensure that we can help those individuals from a monetary standpoint.
And then how does the organization function in terms of funding sources and distribution and also population health management? How does that kind of value chain work?
So we are a nonprofit. I always say, nonprofits do the hard work, and we rely a lot on donations from individuals so that we can provide the assistance necessary. So we are here. We are providing that, copay assistance, case management, legal aid. If we can provide it, that's what we're doing in our funds. We wish they would go further, but we're at the mercy of those corporations who do want to donate.
Is there anything that you've done? And that's great. And hopefully, we'll definitely share maybe a link on the website for where to donate. That's really important.
Yes.
Is there anything that you've done to try to maximize or any? And I know that we haven't really discussed this prior, but
Mhm.
a lot of people manage funds like this, right? And you've been very successful. We've talked about the work that you've done even prior to this. We've seen the ROI is good. Any tips for or advice for people getting into this space, working in public administration like this, on how to really make sure those dollars go really far?
ROI, always,
Mm,
right? Looking at the return on investment. That's going to be key. If you are looking at your platforms from an IT standpoint, you have to house this data somewhere, right? So making your dollars go stretch further is going to be all about efficiencies that are in place to help these individuals so that your administrative costs are low, but the
mm.
amount of funding that is actually going to individuals that you're serving is higher. So we're always looking at our infrastructure, looking at how you can make the process faster, but still compliant at the same time. But that's where you're going to see your dollars going further, is that your infrastructure is in place and you can put more money up front to those individuals who need it.
Because it's that struggle of kind of the bureaucracy in a way, right? Of
That's
having to,
right.
okay, we have to legally make sure all this stuff is done, but at the same time, that costs a lot of money and we have to get that out there. That's very challenging.
Yes.
Do you see the need for legal aid a lot in the healthcare community, in the community with the people you're working with? Is legal assistance needed frequently?
For us, we have a program, it's an access program, and we help individuals who are going through the Social Security disability process. If you've talked to anyone who's gone through this
Yeah.
process, it is not easy. So we have attorneys that represent individuals for free that
Mm.
are appealing Social Security disability decisions. So they've been denied and they're, hands are up. I don't know what else to do. Where am I going to turn? So, yes, we see individuals who are coming to us saying, I can't work, but I need this funding to be able to live. And then our attorneys will represent them in front of a judge and put their case together as to why they may be suitable for Social Security disability. But that's just that representation piece. We also have individuals that just call our hotline and say, I need to know how I can get an exception at work, or
Mhm.
how am I going to continue to put my child through school? What does a plan look like, so that they are making this dual sided, not just their employer telling them what to do, or not just the school system telling them what to do, but they are coming up front saying, "These are my needs." right?
Yeah.
And I'd like to put a plan together that works for me or works for my child. So unfortunately, we do see people that need that assistance.
And so, in one end, you're kind of trying to streamline internal bureaucracy so that you can spend money fighting the external
That's right.
bureaucracy.
That's right.
My dad went through the SSDI process for disability, and so it is crazy, right?
It
And that's
is.
kind of why I wanted to ask, because you're talking about how every dollar you're watching, you're trying to get it to stretch, but then outside we're fighting these forces. So that's again, as a community,
Yes.
what we said from the beginning, it requires us coming together and partnering. Really important. Thank you so much for coming on and talking with us.
Yes.
This is a great organization, and you're a great individual to talk with. I hope we can have you on again.
Yes, I would love to. Thank you so much for having me, Cole.